Have you noticed how your body feels different in the morning lately? That slight stiffness, that morning fog. They're not just signs of aging, they're messages, quiet whispers from your body asking for attention. Let's talk about one amorgus. We grew up with a clear principle: prevention is better than cure. For decades, regular medical checkups were considered the best way to detect diseases early and prevent worse things from happening. But at a certain age, let's say 70, this rule no longer applies. What used to be helpful can now do more harm than good. And that's exactly what we're talking about today. Imagine you are 74 years old, mentally fit, and active in everyday life. Your family doctor suggests you have a few tests done just to be on the safe side. Blood tests, ultrasound, maybe a full-body CT scan. Sounds reasonable, right? But this is where the real problem begins. These tests can find things that are harmless, so-called incidental findings, small cysts, harmless calcifications, or minimal changes that would never cause any symptoms in 99% of cases. But because they have been discovered, a chain of unnecessary treatments, anxiety, and often even surgery begins. One example is the so-called full-body preventive CT scan. It sounds modern and thorough, but it is highly controversial among seniors. That's because it almost always finds something that needs to be investigated. A tiny shadow on the lung, a thickening in the intestine, a lump on the thyroid gland. Most of these are completely harmless, but suddenly, the person is no longer a senior citizen enjoying life, but a patient on an odyssey through waiting rooms, biopsies, and perhaps even surgery. The truth is that with increasing age, the risk of overdiagnosis outweighs the benefits of early detection. This is because every procedure, every contrast agent, every anesthetic, puts strain on an older body, even if it is just to be on the safe side. And the psychological strain of constant diagnoses, checkups, and suspicious symptoms is enormous. Many older people report that they suffer more from the anxiety that came with the diagnosis than from the actual disease. Scientific studies confirm this observation. Several large-scale analyses have shown that certain early detection tests in people over the age of 70 rarely deliver the expected benefits, but instead lead to complications and incorrect treatment more often. Of course, this does not mean that you should cancel all doctor's appointments after the age of 70, but it does mean that you should be cautious about blanket recommendations. It is not about testing everything, but about weighing up the options wisely, together with your doctor, based on your quality of life, personal medical history, and realistic benefits. In the next chapter, we will look at one of the most common, but also most overrated preventive medical checkups, and why it is particularly important to take a critical look at it from the age of 70 onwards. If you are interested in this topic, write Chapter 1 Red in the comments. That way, I'll know you're still with me, and we'll continue right away. Many men over 70 are familiar with it, the PSA test. It's a simple blood test that measures the level of prostate-specific antigen. It sounds harmless, is quick to do, and is offered by many doctors almost automatically, often as part of a health checkup. But what many people don't know is that this test can do more harm than good, especially in older men. PSA levels rise not only in prostate cancer, but also in benign conditions such as age-related prostate enlargement or inflammation. A slightly elevated level is almost normal for men over 70. However, as soon as this level is measured, a spiral of fear, checkups, biopsies, and in the worst case, surgery often begins, which can permanently affect the everyday life of an older man. What surprises many people is that studies show that prostate cancer in older men grows extremely slowly in the majority of cases, so slowly that it often never causes any symptoms or becomes life-threatening. These are known as indolent carcinomas, which often go unnoticed in a 70, 75, or even 80-year-old body unless actively sought out. But when they are discovered, they are often treated aggressively. For an older man, prostate surgery or radiation means weeks of pain, risk of incontinence, impotence, and hospital stays. And all that for a tumor that might never have become a problem. It sounds absurd, but it is the sad reality. Another problem is that the PSA test is extremely unspecific. An elevated level does not automatically mean cancer, and a normal level does not rule out cancer. Nevertheless, many seniors worry themselves sick for weeks when their PSA level is slightly elevated, often for no reason. This is because up to 75% of abnormal results do not ultimately indicate a relevant tumor. The current recommendations of professional associations such as the German Society of Urology and the U.S. Preventive Services Task Force are therefore very clear. After a certain age, usually 70 or 75, the PSA test should only be performed if the patient has been explicitly informed about it and has made a conscious decision to undergo it. The basic idea is, treat the patient, not the number. Treat the person, not the lab result. If an older man is fit, has no complaints, and enjoys his everyday life, a questionable blood value should not force him into the role of a patient. What can you do instead? Observe your body. If you experience discomfort when urinating, frequent nighttime urination, blood in your urine, or pain, then it makes sense to get it checked out. But don't just do it on suspicion, because a blood test says so. In the next chapter, we will focus on a test that particularly affects women, and show why, from the age of 70, it tends to cause emotional stress, rather than provide health reassurance. If you found Chapter 2 helpful, please comment with PSA understood. We read everything and are glad you are here. For many women, it was a familiar routine for decades, the mammogram. Once a year or every 2 years, they would go to the radiology department, have their breast scanned, breathe a sigh of relief, or in the worst case tremble, wait, and undergo a biopsy. But what hardly anyone talks about openly is that after a certain age, usually over 70, this examination often becomes a psychological burden with questionable benefits. Why? Because the benefits of mammography decrease dramatically with age. In younger women, it helps detect aggressive tumors early, before they spread. But after age 70, the rules change. Most breast cancers in older women grow slowly. They often cause no symptoms, remain stable, and would have little impact on life expectancy even if left untreated. Nevertheless, mammograms also reveal these inconspicuous findings, known as overdiagnoses. What follows is an avalanche of biopsies, fear, surgery, radiation, and hormone therapy, all for a tumor that may never have become dangerous. Studies from the US and Europe show that in the over 70 age group, mammograms lead to a surprising number of treatments that put a strain on the body without prolonging life. And then there are the false positives, abnormal mammograms that later turn out to be negative. These are particularly common in older women because age-related tissue changes can distort the images. The result: weeks of anxiety, appointments, and sleepless nights. For nothing. Another problem is that the mammary gland changes with age. The tissue becomes fattier and less dense. This makes it more difficult to interpret the images, which in turn increases the rate of unnecessary follow-up examinations. And so the cycle continues. Leading professional associations, including the U.S. Preventive Services Task Force and the German Society for Gynecology and Obstetrics, now emphasize that mammograms should no longer be performed automatically in old age. Individual risk factors are much more important, such as family history, genetic mutations, or previous aggressive cancers. If these are not present, the examination can often be dispensed with. What does this mean for you specifically? If you are over 70, have not had any breast problems to date, have no family history of breast cancer, and feel healthy, then it is perfectly legitimate to question the need for mammograms. An open discussion with your doctor can provide clarity here. Instead of relying on technology, with age, we tend to focus more on how our bodies feel. Noticeable lumps, pain, changes, these are the real warning signs. If you don't feel anything, and there is no cause for concern, foregoing mammograms can actually give you greater peace of mind, because sometimes health is not what we measure, but what we can enjoy in peace. If you can relate to this chapter, or have had your own experiences, please comment with mammograms, a balanced decision. In the next chapter, we look at a particularly sensitive routine examination, bone density measurement, why it is often misunderstood, and what really helps against osteoporosis. Does this sound familiar? The doctor says during your checkup, let's measure your bone density, just to be on the safe side. And suddenly you're sitting in a white room, your legs on a couch, a device whirring over your body, and a few days later, you're holding a piece of paper in your hand. T-score, -2.3. Osteopenia, almost osteoporosis. A few millimeters less calcium in your bones, and a cycle of fear, medication, and follow-up checks begins. But how much does this value really tell you? And more importantly, is it even meaningful at your age? Many seniors believe that bone density measurement is the key to preventing falls, but this is a dangerous misconception. This is because bone density alone tells us surprisingly little about the actual risk of bone fractures. Much more important factors include: how often do you fall? How good is your balance? How strong are your muscles? How good is your eyesight? An 85-year-old man with slightly reduced bone density, but good balance and muscle strength, often has a lower risk of bone fractures than a 70-year-old woman with excellent bone density, but unstable knees and chronic dizziness. And here lies the problem. Bone density measurement, DXA, is a purely statistical value. It compares your bone mass with that of an average 30-year-old. Sounds absurd. It is. Because what does a negative value compared to a young body tell us? It makes us feel insecure. It triggers thoughts of deficiency that need to be combated with medication, often for years. Medications such as bisphosphonates or denosumab are then quickly prescribed. But these drugs are no walk in the park. They can upset the stomach, alter jawbone tissue, or lead to atypical bone fractures, exactly what you want to avoid. And often the benefits of these drugs only outweigh the risks in cases of really severe osteoporosis, but not when values are only slightly reduced. The situation becomes even more critical when the T-score becomes a kind of sword of Damocles. Many affected individuals begin to exercise less for fear of fractures, and that is precisely the biggest mistake. Exercise strengthens bones, muscles, and balance. Those who adopt a protective posture out of fear risk exactly what they want to avoid: a fracture after a fall. Therefore, if you are over 70, have not suffered any fractures, and do not have any risk factors such as severe rheumatic diseases, long-term cortisone therapy, or a family history of osteoporosis, routine bone density measurements are usually unnecessary. A functional fall risk test, which many family doctors and physical therapists can perform, is much more useful. After all, if you stand securely, you won't fall. And if you don't fall, you won't break anything. What really strengthens your bone health? Vitamin D, moderate strength training, regular walks with slight inclines, dancing, balance exercises. All of these are often more effective than any pill. Once you have read this chapter, and perhaps even measured your bone density yourself, write exercise instead of numbers in the comments section. Because at the end of the day, it's not the number on the paper that counts, it's how you walk through life. In the next chapter, we take a critical look at a seemingly harmless standard procedure, the resting ECG, and why it often causes more confusion than reassurance in seniors. It sounds like a harmless checkup. Let's do a quick ECG. You sit down, a few electrodes are attached to your chest and arms, and after a few seconds a graph appears on the monitor. Jags, lines, waves. A doctor takes a quick look, and then the nightmare often begins. There's a small irregularity. We should investigate further. And suddenly you're standing there, a 75-year-old man with no symptoms whatsoever, or an 82-year-old woman with no complaints, and you're sent from appointment to appointment. Long-term ECG, stress ECG, ultrasound of the heart, cardiologist, MRI, maybe even a cardiac catheterization, all triggered by a small, conspicuous blip on a monitor, which in many cases is meaningless. What many people don't know is that as we age, more and more people show changes in their resting ECG, and this is completely normal. So-called left ventricular hypertrophy, i.e. a slightly thicker heart muscle, minimal repolarization disorders, or prolonged QT intervals, are not uncommon in seniors. They do not necessarily indicate a disease. They are often just signs of an aging, but still well-functioning heart. The problem is that many of these ECG changes lead to false positive results. This means that a danger is suspected, where in reality, there is none. As a result, unnecessary follow-up examinations are carried out, some of which are invasive, some stressful, and often involve waiting times and worry. And it is not uncommon for this path to end in the prescription of medication that may not have been necessary at all. A particularly typical example is atrial fibrillation. Many seniors experience occasional episodes of this heart rhythm problem without even noticing. If it is discovered by chance during an ECG, treatment with blood thinners is usually started. However, studies show that not every silent episode requires treatment, especially if it is rare and does not cause any symptoms. Nevertheless, it is often treated as a danger. Another example is bradycardia, which is a slow heartbeat. Seniors who regularly go for walks, do yoga, or have low blood pressure often have resting heart rates below 60. In many cases, this is harmless, but it is still considered abnormal on an ECG, which can cause unnecessary anxiety. What's more, a single resting ECG cannot provide any real information about the heart's performance. It is a snapshot in time, nothing more. Without symptoms such as chest pain, shortness of breath, or severe performance drops, its informative value is extremely limited. That is why many modern family doctors now recommend that a resting ECG should only be performed if there is a medical reason for doing so, i.e., if there are genuine symptoms. As a routine checkup for healthy seniors, it can do more harm than good. If you have ever had an ECG done, just like that, without any symptoms, and were suddenly confronted with concerns or further tests, then you know how quickly you can get caught up in this spiral of tests. Feel free to write in the comments, "My heart knows its rhythm," if you recognize yourself in this. Because in the end, what matters is how you feel, not what a machine thinks. In the next chapter, we look at one of the most popular imaging procedures for seniors, CT scans for cancer screening, and why they cast more shadows than they shed light for many people. Just to be on the safe side, let's take a look. This is often the reasoning given when older people are recommended a CT scan. Particularly popular are CT scans of the lungs, abdomen, or prostate, supposedly to detect tumors at an early stage. And of course it sounds reasonable at first. Who doesn't want to know if there is a hidden enemy lurking in their body? But this is precisely where the dilemma begins. Computed tomography is a fascinating procedure, no question about it. It provides detailed cross-sectional images of our bodies, layer by layer, precisely and quickly. But it comes at a price: radiation. And not just a little. Depending on the region, a CT scan can release up to 100 times more radiation than a normal X-ray. This may be manageable for a young body, but for people over 70, whose cell repair mechanisms are already working more slowly, the risk of radiation-induced cell changes is real. Particularly critical are CT scans performed as a precautionary measure, i.e., without any specific suspicion. This is because the following often happens. Something is found: a small shadow, an unclear lump, a minimal thickening. None of these cause any symptoms, and in the vast majority of cases, they are harmless age-related changes. But because no one can say for sure, a chain of follow-up examinations begins. More CT scans, biopsies, sometimes even surgery, all based on a finding that probably would never have caused any problems. A well-known example is lung cancer screening. Older people, often long-term smokers, undergo a CT scan to detect lung cancer at an early stage. It sounds sensible, but the studies are contradictory. Many of the changes detected are benign. Nevertheless, they are followed up, punctured, and in some cases removed, which can cause anxiety, pain, and complications. Abdominal CT scans also often reveal incidental findings: cysts on the kidneys, benign liver changes, calcifications on the pancreas. These sound alarming, but in people over 70, they are often completely normal. Nevertheless, they often set off alarm bells. What many patients do not know is that there is no general recommendation in Germany for symptom-free people over the age of 70 to undergo CT scans for early cancer detection. On the contrary, the Radiation Commission and the Federal Office for Radiation Protection expressly warn against unnecessary CT scans without clear medical justification. Another problem is that many CT scans are performed with contrast agents, substances that can cause problems, especially in older people with impaired kidney function. It is not uncommon for creatinine levels to deteriorate after a CT scan with contrast agent, which is a sign that the kidneys are struggling. Therefore, CT scans are a valuable tool, but they should be performed by experienced physicians and used only when necessary. If you have no symptoms and a CT scan is recommended only for safety reasons, ask critical questions. What exactly is the scan intended to rule out? Is there another method that involves less radiation? What happens if something is found? Feel free to write in the comments. I ask twice before I go for a CT scan, because your body has already been through a lot. It deserves careful consideration, not snap decisions. The next chapter deals with another routine examination that raises more questions than it answers in seniors: bone density measurement, and why it should also be treated with caution. Osteoporosis, the specter that haunts many people over the age of 60. The fear of breaking their femur in a minor fall, or of their spine slowly collapsing, drives many seniors to undergo bone density testing, also known as a DXA scan. This is an imaging procedure that measures the mineral density of the bones and converts it into a T-score. The lower the score, the greater the risk of fracture, according to the test. It sounds objective. It sounds logical. But that's exactly where the problem lies. What many people don't know is that these values are based on statistical comparisons with young, healthy people. A 75-year-old person is therefore measured against the bone strength of a 30-year-old, and that almost inevitably leads to a poor result. This in turn opens the door to medications that often do more harm than good. An example: Ingrid, 79, from Kassel. Her family doctor recommended a bone density test to be on the safe side. The results were borderline, which quickly led to a diagnosis of osteopenia, a precursor to osteoporosis. She was prescribed bisphosphonates, drugs designed to stop bone loss. But after just 2 months, Ingrid had severe jaw pain, a known but rarely mentioned side effect. The tablets were discontinued. Her trust was shattered. What many people don't know: bone density measurements only show part of the picture. The bone structure, i.e., how finely branched and stable the internal framework is not measured at all. And even more importantly, bone density alone says little about whether someone is actually at risk of falling. This is because the most common fractures in old age are not caused by weak bones, but by balance problems, visual impairments, or incorrect footwear. And even if osteoporosis is actually present, the question remains whether drug treatment is always advisable in old age. Studies show that the so-called fracture risks are often overestimated, especially in women over 75, who are otherwise healthy. The drugs, on the other hand, can have serious side effects: jaw necrosis, atypical femur fractures, gastrointestinal problems, or cardiac arrhythmia. In addition, bone density measurements are often repeated too early or too frequently. Bone density changes very slowly in older people. A measurement every 5 to 10 years is sufficient in most cases, if at all. So what is the better alternative? Exercise. Studies show that targeted muscle training, balance exercises, and vitamin D intake have a much greater impact on fracture risk than pills alone. People who dance regularly, do Nordic walking, or perform targeted gymnastics exercises have been shown to break their bones less often, even if their bone density is not perfect. Our tip: don't let numbers unsettle you. Ask questions. Why is this measurement being taken? What does an abnormal value specifically mean for me with regard to? Are there alternatives to medication? And above all, what can I do myself? Feel free to comment below with "My bones need exercise, no panic." Because even in old age, we can actively do something for our bone health with common sense instead of blind fixation on measurements. In the next chapter, we'll take a look at a particularly controversial measure: regular full-body checkups, why they often cause more uncertainty than clarity, and what you can do instead. Imagine you arrive at the doctor's office in the morning. A friendly smile and a soothing voice say, "Today we'll check everything: blood, heart, lungs, liver, kidneys, thyroid, pancreas. Just a checkup." Sounds good, right? Like a kind of MOT for the body. But what if this health check raises more questions than it answers? Unfortunately, this is happening more and more often, especially in people over 70. The so-called big checkup is popular, and in many cases unnecessary, or even counterproductive. Why? Because it often leads to so-called incidental findings. This means that something is discovered that is not acutely ill, but is also not clearly harmless. A small shadow on the lung, a slightly enlarged prostate, a minimally altered liver structure. What now? Suddenly, a chain of tests begins. CT scans, MRIs, biopsies, stress, anxiety, hours of waiting. In the end, it often turns out that everything was fine. Or you start treatment, even though there was no illness, just a value, an image, a deviation from the ideal. Gerda, 74 from Ulm, knows this all too well. During a checkup, a slight change in her blood count was detected, slightly elevated inflammation levels. It could be anything, or nothing, said the doctor. This was followed by an ultrasound examination, then a CT scan, then a referral to rheumatology. Gerda lived in fear for months. In the end, the verdict was, probably age-related. The symptoms? She never had any. Many doctors now admit that these comprehensive checkups can do more harm than good for older patients. This is because the body changes after the age of 70. Values that would be abnormal in younger people are often normal in older people. And the more you look, the more you find, without it making any real difference to quality of life or life expectancy. What's more, many of these abnormalities lead to interventions that put unnecessary strain on the body. A puncture here, a contrast agent there. You slide into a medical spiral that is difficult to escape. Instead, Many experts advise focusing on what is really important. Do you have any complaints? Are there any symptoms that worry you? If so, then yes, get them checked out. But simply scanning everything because you think it's sensible, that can end up having the opposite effect. Too frequent comprehensive checkups can even destroy your trust in your own body. You suddenly feel like you've been made sick. Constant confrontation with potential risks can lead to crippling anxiety. Studies show that people who feel healthy and have no symptoms benefit little from blanket screening measures in old age. What helps instead? Regular consultations with a doctor who really knows you. Someone who knows what is normal for you personally. A doctor who asks, "How are you really?" instead of just reading blood values. That's why we urge you to trust your body, trust your instincts, and ask your doctor critical questions. What happens if we don't investigate this? What would be the consequences of a diagnosis? Would this information make me healthier or just more anxious? Feel free to write in the comments, "I am more than my blood values," because that is exactly what you are. A person with experience, with a history, with a sense of what is good for you. In the next chapter, Chapter 9, we'll look at a particularly controversial test, colonoscopy, for people over 75, when it makes sense, and when the risks outweigh the benefits. Stay tuned. For many years, it was considered indispensable. The colonoscopy, medically known as colonoscopy, it can save lives, it is often said, because it detects colon cancer at an early stage. And indeed, between the ages of 50 and 70, it can be a useful tool, especially if there is a family history of the disease. But what happens if you have this test done over the age of 75? Just to be on the safe side. This is where it gets tricky, because at a certain age, the benefits and risks of this examination are reversed. Many seniors are unaware that a colonoscopy is not a minor procedure. It is invasive, requires intensive preparation, can lead to complications, and the risk increases significantly with age. For many, the preparation is already stressful. The bowel must be completely emptied. This means drinking several liters of laxative fluid within a few hours, which is physically demanding and not without risk for many people over the age of 75. Circulatory problems, dehydration, and electrolyte imbalances can all occur before the actual procedure. Then comes the colonoscopy itself. A flexible instrument is inserted through the anus to examine the entire colon. This can cause injury to the intestinal mucosa, or, in very rare cases, even intestinal perforation, especially in older people with sensitive tissue. What is not a problem for a 50-year-old can lead to surgery for an 80-year-old. What's more, studies show that the likelihood of an aggressive, treatable cancer being detected during a colonoscopy after the age of 75 decreases significantly. At the same time, the likelihood of harmless polyps being detected and removed increases, with all the associated risks, but without any real benefit. An example, Friedhelm, 78, from Essen, underwent a routine colonoscopy on the advice of his doctor. Even though he had no symptoms, a small polyp was removed. 2 days later, he experienced severe abdominal pain. The diagnosis, intestinal injury. He had to undergo surgery and spent a week in the hospital, all because of a change that would probably never have become a problem. The guidelines of the U.S. Preventive Services Task Force, but also increasingly European recommendations, now advise that routine colonoscopy from the age of 75 should only be performed if there is a justified suspicion, for example blood in the stool, weight loss, or chronic diarrhea. Simply checking is no longer advisable. What can be done instead? For example, the immunological stool test, IFOBT, is a non-invasive method for detecting hidden blood in the stool. It is much less stressful, quick to perform, and in many cases sufficient to assess risks. If abnormalities are found, targeted action can then be taken. But even more important, pay attention to your body. Are your digestive habits changing? Do you have pain that you can't explain? Then you should take action. But getting a colonoscopy just out of fear or routine can do more harm than good, especially in old age. Not everything that is medically possible is medically advisable. It is much more important to weigh up the options. How much life expectancy do I realistically have left? What quality of life is important to me? And how stressful would a possible treatment be if something were actually found? If you ever need to have a colonoscopy in old age, ask your doctor the following questions. What exactly are we looking for? What would a diagnosis mean for my life in concrete terms? Is there a gentler alternative? Because your years are precious, and it is often better to spend them in peace, without unnecessary interventions. with a body that tells you, I'm working the way I should. The next chapter, Chapter 10, deals with one of the most controversial tests for seniors, breast cancer and prostate screening. Why these checks often cause more fear than clarity in old age, and what really matters. In younger and middle age, they were considered important pillars of early detection, mammography screening for women and PSA testing for men. For decades, the mantra was, the earlier, the better. And indeed, these methods are justified in certain age groups. But what if you are 75, 80, or even 85 years old? Are these tests still useful, or are we perpetuating an automatic response that does more harm than good? Let's start with mammograms. Women between the ages of 50 and 69 receive regular invitations for breast cancer screening. But what about women over 70? For them, screening is voluntary, and for good reason. Studies show that the benefits of mammograms decrease with age. Why? Because many of the changes detected are what are known as overdiagnoses, tumors that grow so slowly that they would never cause any symptoms. They would simply be part of the natural aging process.